Today we are going to learn about diabetes, the different types of diabetes, how it develops, what we can do about it, some of the symptoms. So let's start with the types of diabetes. First, we have type 1 diabetes, and this is pretty much genetic. It oftentimes develops in younger people. I have a younger cousin who dealt with it, or who is working through type 1 diabetes, and you just have to manage it. Life isn't over. It makes life a little more difficult, but not terrible. And what happens is you have this pancreas right here, this yellow organ, and what it does is it secretes insulin when we have our blood sugar rise. And if it's not working properly, well, then that can cause some significant issues. You can go into a coma, you can pass out, different things like that. Hyperglycemia, hypoglycemia, lots of problems. We have type 2 diabetes. This one has genetic influences, so this runs in my family, but a lot of it is lifestyle, so you can reverse it. If you get type 2, you just need to learn how to live your lifestyle so that you can avoid type 2 diabetes. And then we have gestational diabetes. This develops during pregnancy for some women. While you're pregnant, blood glucose levels are increased, and that can sometimes cause gestational diabetes. But again, through lifestyle changes, we can hopefully we can reverse that. So let's take a look at what the life with diabetes looks like. So if you do have diabetes, you have to monitor your blood sugar level. If you don't, your pancreas does this for you, so you're fine. But if you have glucose resistance, or I should say insulin resistance, or something wrong with your pancreas where you're not releasing insulin, then you're going to have to monitor it yourself. And the way you do this is you take a little finger prick, and then you measure it with a little strip in this little unit here, and it'll measure the actual sugar in your blood. And then based on that, you might have to do some different things. One thing you can do is exercise to lower that blood sugar. You might have to inject some insulin. So if you have type 1 diabetes where you don't produce insulin, you're going to have to inject insulin normally into the stomach region. You get good at doing this. Obviously, it's not ideal, but that's how life goes sometimes. So you just need to learn to manage it. There are some new things coming out. They have a little continuous blood glucose monitor. It'll go on the back of your arm or maybe somewhere else. And it's not as accurate as this measurement right here, but it's just constantly monitoring you. So it's a good little tool to have. And then they have insulin pumps. So you can have like a little thing on your belt, and it'll have a little needle into you, and it'll automatically pump in insulin when you need it. So there are ways to manage it. Your life isn't over if you have it, but ideally we would like to find a way to control it. So what happens when we're developing, let's start with when we eat. So when we eat food, what happens is our blood sugar rises because the food starts to enter our bloodstream in the form of sugar. So blood sugar increases, as you can see on the red right here. Then what happens is your insulin is produced in response to that, because if we have blood sugar running around our bloodstream, that's not going to be healthy for us. It causes damage to our endothelial cells, that's the inside of your blood vessels, increases risk of stroke, heart attack, all this bad stuff. So we need to pull that blood sugar out, and insulin helps us do that. But what happens is, let's say you drink soda every single day, or like those really high sugar coffees. I mean, they're delicious, but let's say you do that every day, or you eat candy every single day fairly often. You're spiking that blood sugar over and over, and then we release that insulin over and over. And it can occur at a bunch of different places, but basically you can maybe stop producing so much insulin, or you can become insulin resistant. And if we think about your cells, on the cell wall, there are these GLUT1 and GLUT4 receptors. And when we release insulin, when our blood sugar goes up, is the insulin connects with one of those GLUT4 receptors, and then that opens up the cell's ability to pull sugar out of your bloodstream. So insulin has kind of got a bad name at the moment because people say it stores fat. Yes, it does, but it's doing it to pull the blood sugar out of our system. So we need insulin. Insulin is really good for us. It pulls out the blood sugar into your muscles to store as glycogen, and it also stores it in fat cells. But the point is, we need to reduce that blood sugar. And if we're constantly spiking our sugar over and over, we can become resistant to that insulin because our cells just aren't listening to that insulin release as well. So with type 1 diabetes, and this could happen with type 2 depending on how the pancreas is functioning, is the pancreas also releases glucagon, which, let's say your blood sugar is low because you haven't been eating for a while. Your body can actually synthesize sugar through your liver and turn it into glycogen, or turn glycogen into glucose. What happens then is your body will manually increase your blood sugar so it doesn't drop too low and so you don't go into a coma. But if your pancreas isn't functioning to release that glucagon, then what can happen is your blood sugar can drop. And especially with type 1 diabetics, in this case, you need to carry sugar, particularly with exercise, so you can reboost those blood sugar levels. So type 1, you really have to control it. Type 2 diabetes, we can control with lifestyle things and hopefully not have to experience it. Let's look at some symptoms real quick here. So glucose in urine, if our body isn't pulling that sugar out of our bloodstream, it ends up in our urine because our kidneys are filtering it out. It can be somewhat hard on your kidneys, so not ideal. We also see frequent urination. I actually had a friend who he was carrying too much fat mass, didn't have the healthiest diet, was frequently urinating. He had type 2 diabetes or was developing it, but he was already making lifestyle changes, and I think he's completely reversed it now, so that's kind of good. With exercise and good nutrition. Excessive thirst, so always being thirsty. Extreme hunger. We have fruity breath as well. What happens here is if your cells aren't able to pull sugar out of the bloodstream with the use of insulin, so you don't have enough insulin in your system or it's not working properly, then what happens is your body is going to start producing ketones as energy instead of pulling that sugar out. And then this results in a fruity breath. So that's kind of a symptom. We got unexplained weight loss, increases in fatigue, irritability, blurry vision. So one of the things that happens with diabetes is this high blood sugar kind of can wreak havoc on our vascular system. And in your eyes, you have very tiny blood vessels. And the tiny blood vessels are the ones that get damaged first from all this high blood sugar. So, eventually it can get as bad as causing blindness. Not ideal. It can also cause like gum disease because you have blood vessels in your gums, and your blood is what helps your body recover. And so if you can't get good blood flow, those parts of our body start to degrade. We got numbness and tingling in hands and feet. This is the same thing. So our blood vessels in our hands and our feet can be somewhat small, and they're kind of near the extremities, right? And then you start getting less blood flow. Slow healing wounds, same thing. Diabetics really need to take care of their feet because, again, we have that reduced blood flow down there, and then the wounds don't heal as well because, again, that blood delivers, supplies to heal wounds, and then an increased infection rate as well. So those are some symptoms. Feeling lethargic too can be one of them. That's that fatigue, right? So what can you do? Number one, you can reduce fat mass. And again, you only want to reduce fat mass if you have fat mass to reduce, right? Because we need some to be healthy. But carrying excess fat mass is going to increase the risk of insulin resistance. Regular exercise, this is like one of the number one things. So strength training or cardio, they actually increase the sensitivity on those GLUT1 and GLUT4 receptors. So let's say you have type 2 diabetes and you're insulin resistant, so those GLUT1 and GLUT4 receptors aren't binding to the insulin. Exercise actually makes it more likely that they're going to bind better. So it's like the best thing you can do, pretty much. Number 3, standing or moving after you eat. So after you eat, blood sugar starts to spike. And what you can do is you want to move around afterwards. So I have a standing desk now, so after I eat, I will stand up. So that's a good one. I sometimes do chores after I eat, so I'm moving around. So if you stand or if you eat or if you do some like quick strength exercises for like 15 to 30 minutes after eating, that actually reduces the blood sugar spike because your body is using that sugar. So that's a good tip there. Decreased intake of trans fat. Trans fats are almost out of the American diet at this point, so that's pretty good. Increased omega-3s. So this is why we should eat fish twice a week. We have flaxseed is really good. Olive oil. We have any ocean-going fish, so like salmon. Oysters are really good. Mackerel's pretty good. What else? Grass-fed beef. Chickens, free-range chicken eggs are pretty good in omega-3s. So there you go. There's some good tips. You can look up more omega-3 foods. Decreasing your sugar intake is pretty good. So sugar isn't always the bad guy. You need sugar to be healthy. And these are carbohydrates, right? Sugar is a carbohydrate. But if we're always eating like simple sugars, like high fructose corn syrup, that is going to kind of abuse our insulin system. Increasing fiber. Fiber is really good for us. This is in fruits and vegetables, so increasing that intake slows down digestion. We have starch as well. Starch is interesting because if you have diabetes, you should avoid starch, especially type 1, because it really increases blood sugar a lot. Potatoes are a starch. Corn is a starch. The thing about starches, though, is that it may improve your resistance or your insulin resistance long term. So like 4 days out, I believe. So, for type 2 diabetics or just for people who aren't diabetic who want to kind of, hopefully avoid developing type 2, eating starchy vegetables is a part of a healthy diet. So don't avoid those entirely. Although some people might, like type 1, you might have to avoid them. And then decreasing your red or processed meats. Sometimes saturated fat can actually increase blood sugar in some people, and I believe that's fairly genetic. So if you're eating high saturated fat diets, sometimes that can increase our risk of diabetes. All right, well, I think that's enough information for now. If you have any questions, you can leave those in the comments, and I will see you in the next video.